Welcome back. This is The Real Story, where we'll take a closer look at some of the issues, even if it means going back a few days, weeks, months, or years. And today we take a look at how Medicaid is changing in Iowa right now. Medicaid is a program that helps pay for medical coverage for groups of people who have low incomes, are disabled, or elderly, or have any one of another long list of needs that qualifies them for a little extra help. Any disruption to that system could be painful.
Well, I think the worst that can happen is that while managed care organizations are taking a look at cutting costs, it also means cutting services for Iowa's most vulnerable.
As part of the Affordable Care Act, Medicaid was expanded within each state. At first, Iowa Governor Terry Branstad resisted until he was able to get a waiver allowing Iowa to work out the details about how to expand for itself. The result is a customized system where federal funding is used to pay for the policies that low-income patients select from healthcare.gov. It also has initiatives for people on Medicaid to monitor their own health. Branstad calls that having skin in the game. All that came together at the end of 2013. Then in February of 2015, Governor Branstad rolled out a new plan to run Medicaid. He called it the Governor's Medicaid Modernization Initiative, creating the Iowa High Quality Health Care Initiative with 4 private companies who would provide Medicaid services, helping take the burden off the state budget. The Department of Human Services says the cost of providing Medicaid has increased 73% just since 2003 under the old but more traditional model. The transition to those private companies is scheduled to happen January 1st.
It's worked effectively in other states, and I see no reason why in Iowa we can't work it effectively.
For the most part, some Democrats were skeptical that this is the best way to move forward for Iowans. But then at the end of November, an administrative law judge recommended that one of the 4 contracts signed with the 4 private companies be thrown out. That judge said the company should have told the state about fraud and mismanagement involving former executives. The company said they would challenge the ruling. Governor Branstad said the shift to privatize Medicaid would stay on schedule. As of right now, the company is still going to be one of the 4 involved in that system.
These companies are very troublesome, to say the least. And so people here feel very passionately that if we were to move to managed care, that these are not the 4 companies to have.
The concerns over that switch broke down largely along party lines. The benefit pushed by Republicans is that working with a limited number of private companies saves the state money. Democrats are concerned that the quality of care will suffer, even with assurances from the governor's office that the level of coverage will stay exactly the same throughout the transition.
Nobody had any answers for me. Nobody knew anything that was going on.
People falling through the cracks, providers not receiving reimbursement, all of which can really lead to some bad outcomes.
Under managed care, as we've heard from company representatives, they will be making determinations on whether or not what your doctor is prescribing as care is really necessary.
It's got to be frustrating.
Yeah, it is. It's frustrating, but it looks like it's going to happen.
That's where the state is right now. This past week, officials from the Federal Centers for Medicare and Medicaid Services were in Des Moines to review the plan to privatize Medicaid services. But after the prep work to get the transition ready and then the protests from the people that you just heard from who are afraid that it's not going to go well, if those federal officials decide that Iowa isn't ready, they'd be able to stop the transition scheduled for January 1st. Or if they decide it'll be okay, they can let it go through. Coming up after the break, the tweet from one Iowa politician that gave sports fans in the Hawkeye State a good chuckle last week.